Sorry about that, guys. Catherine, can you hear us? We were just having a technical hitch then.
I can hear you, yeah.
Okay, excellent. So welcome to the Value-Based Healthcast. My name is Nick Wilkinson. I'm a paediatrician with a special interest in setting up innovative services, and I'm joined by...
I'm Dee Lowry, and I'm Head of Value-Based Healthcare at Cwmtawd Morgannwg University Health Board.
And we're really excited about today's episode, which is about sustainable healthcare. This, for me, is probably the missing link, and is another motivation to how we can improve healthcare in a value-based approach. And today we're joined by Amy Newton, who's from the Strategic Sustainability Manager with Medtronic, and Catherine Richards from SUSQI. She's program lead, and SUSQI is the Centre for Sustainable Healthcare. Over to you, Dee.
So, why sustainability? Why value-based healthcare? So, if we consider the European Commission definition of value-based healthcare and the 4 pillars of value-based healthcare, we think about personal value. What does it mean to the citizen, to the patient? We think about technical value, how we use our resources, and that includes all assets, how we use our funding, how we attribute our staff in our delivery, use our buildings. We think about allocative pillar of value, then we think about how we can work to reduce the impact of the Invest Care Law and look at disadvantaged areas, and how do we actually improve the allocation of where we deliver our services. The 4th pillar is around the societal pillar of value, and that includes where we can look at issues like sustainability, societal connectiveness and inclusion. Now, a lot of people think it's just about how do we count what CO2 we're saving, right? But sustainability covers a whole range of areas. And actually, we're doing a lot about it already, but we don't always notice it. We don't always record it. We don't even think about it in our business cases. But it is a form of value that is really important to demonstrate the impact that our interventions are having. And now with our NHS Greener strategy, there's even more call, along with more citizens and staff that care about sustainability, for us to be thinking about how we measure it, what does it look like, what does it mean, and moreover, what can we do about it? So I'm really excited to have Catherine and Amy with us today, Nick. We have been looking across Wales, across value-based healthcare, and with our greener parties and our greener scholars about what we can do about sustainability. So we're really pleased to get a bit more information for people to widen our horizons and think about what we can do. So I'm really excited for the presentations today. So I'm going to hand over straight to Amy. So welcome, Amy. Lovely to see you. And over to you.
Fab. Thank you, Dee. Thank you, Nick.
Oh, I think you're on mute.
Oh.
Just while Amy's sorting that out, don't forget, if anyone's got any questions, pop them in the chat.
It's not, you're not on mute. I think it's...
Is it us?
Can you hear me okay?
Oh, we can now. Okay,
yeah,
so
sorry.
yeah, everyone can hear you. So any questions for Amy or any of the presentations as we go through, stick them in the chat. We'll keep an eye on that, Amy. And if any come through, we'll ask you at the end of the presentation before we hand over to Catherine. And then, as usual, we'll have a bit of a discussion. We've got some questions that have already been asked, and we'll run through them. So over
Perfect.
to you.
Lovely. Thank you so much for having me. I feel really honoured to be here. Yeah, so I'm Amy Newton. I work for Medtronic, so a medtech company. A lot of these views are my own, but we have a very strong strategy around sustainability for Medtronic. But you've asked me to speak really today around sustainability and how it's totally intrinsically linked with value-based healthcare, as you just alluded to there, Dee. You know, you've been doing value-based healthcare exceptionally well in Wales, and this is just another lens to look at it. And actually, it supports the work you've already done will support getting to net zero in sustainability. And the environmental piece, but also look at the social value. So it's all very well. I talk about the sustainability stool. So if you think about the stool being sustainability at the seat, and then it's got 3 spindles, one of those being environmental, another being social, and another being economic, which are the 3 areas that you would start to look at what determines value. If one of those is imbalanced, the stool doesn't stay standing. So it helps you think about, right, it might be cheaper, but what is it doing in the other two areas? And that's what you guys have started to do really well, and other healthcare systems have started to deliver value-based healthcare, looking at outcome versus cost. So when you apply it to a healthcare lens, you've got the outcome as the stool, the top of the stool, and you're balancing that with an outcome, and you want that patient outcome to drive patient-centric care. So for me, that just is the perfect illustration to show that intrinsic link with value-based healthcare. And then, like you just said, you know, a lot of people are focused on the environmental aspect, because I think with anything, as long as it's easier to measure, that's where they focus first. But also there's a lot of things in the press, and it's can be very emotive personally. So when you look at the 5 areas that you could start to apply value-based healthcare in the patient pathway, rather than trying to break it down into individual parts of that, ideally, when you're trying to look at the environmental side, just stopping doing something, reduction is the way forward. That's what we're told. But if you switch the lights off, essentially, at hospitals, one, that creates a waste of resource and infrastructure, but 2, that doesn't solve the problem of illness that we have today and the rising chronic disease and aging population. We still need a healthcare system. So then you have to go, right, well, what's the comparison? Right, prevention. That should be where we should, you know, really drive a lot of our energy, because in the long term, if we can prevent healthcare, we know that every £1 that's spent in prevention, you can save 3 to 8 times that later down the line. So you've got cost avoidance, but that also equates to CO2 avoidance. And then if you can't do the prevention piece, because unfortunately climate change is a reciprocal relationship with sustainability, it's the biggest threat to our healthcare systems and our health. But equally, health is also contributing a carbon footprint. So early diagnosis and detection is then where we need to focus. And again, you're taking pressure off and removing that burden of disease further down the line and keeping people well. And then looking at it from a value perspective, where you have to deliver interventions in that early diagnosis piece, where you have to do any sort of an intervention in a surgical or cardiology space, is it meaningful? What does it mean to the patient? So does it drive a good outcome? What is the carbon footprint? What's the social value delivered? And is the patient experience one that is favourable? And that will be linked to your societal value. And so again, where you've been looking at value-based healthcare, you're looking at PROMs and PREMs, this then is intrinsically linked to, just because it might create a net zero, is it the right thing for that patient? And this is where it drives that patient-centered conversation. So for me, sustainability is very much around, is everything we're doing meaningful? Is it the right intervention at the right time for the right patient? Which is the narrative we've had through a number of different initiatives. It's just looking at what is the right thing to do for a patient. And that is what value-based healthcare is, but it's getting everybody on the same page to define what that value looks like, and deciding what, you know, if you have to treat a patient, if you have to do surgery on a patient, what is the comparison? What happens if you do nothing? Because that's the argument you would get from a sustainability perspective. What happens then? And that's how you can start to build those 2 metrics into a business case. I like also that, you know, this is also a lot about our own personal accountability for us as people in our own health, but also when people say, what can I do? Well, that just in case mindset that especially COVID has driven. So 2 things have come out of COVID, haven't they? They've driven massive amounts of efficiency in digital care and patient access to efficiencies, despite the backlogs that we have. But on the flip side, it's created that just in case mindset, a very like single use mindset, which we're coming out of now. But we've got to remember that we've got to drive quality, and we've got to try, you know, manage that patient risk of infection and quality. So again, it's about balance. You know, it's not necessarily just single use versus reusable. It's about segmenting that and saying what's the entirety, the holistic viewpoint of that patient pathway or that patient journey, what's the carbon footprint, and where can we actually drive that CO2 reduction and still maintain that patient outcome? Because if she shifted everything to reusable overnight, we'd then just shift the burden downstream, and we'd start looking at that, CSSD, have we got capacity? What about those chemicals? How do you compare the two? Again, from a value-based healthcare perspective, it's a multi-stakeholder approach. You have to bring it. Collaboration is key. And what I'm hoping is that in value-based healthcare, it should, drive that collaboration across all parties, stakeholders, industry, etc. But I think the environmental lens actually forces us in a room together, because we all have a skin in the game, essentially. We have a risk. And we all have to get there. Net zero is inevitable, so we have to get there. So I think from my perspective, I think it is intrinsically linked. I think we need the tools. We need to be able to demonstrate it. I think we need to then also be comfortable with failure in that space. As long as there's a good patient outcome, learning from what we've done and sharing will help the challenges that we've seen with incorporating value-based healthcare and doing things differently, because there is a bigger reason other than just individual patients that might not feel so tangible. The environment feels intangible to all of us. So I think, having those tools, demonstrating that, sharing best practice, scalability is key, collaboration is key. I think that's where Centre for Sustainable Healthcare definitely come in.
Fantastic.
Yeah.
Were you going to add anything else? Sorry, there was a pause.
Yes,
there.
Sorry. My one nugget, I normally start with this, but is that I liked, I don't know if you've read Donut Economics by Kate Raworth, but she talks about if we envisioned ourselves living on a spaceship, we would all suddenly start living very differently. And that's almost how we have to picture it. So with everything we do, we have to start thinking like we do not have infinite resource. And essentially we do. Planet Earth really is a spaceship, but we don't think of it that way. So I think that, one drives accountability for consumption, but two also drives community, which in our world would then drive societal benefit.
It's interesting you mentioned the spaceship when one might argue that that's not sustainable, but I do love your
absolutely.
I do love your backdrop.
Thank you.
and obviously it's the right thing. And obviously it was the International Day for Biodiversity on Monday.
It was.
So we're managing to fit a theme here. Now it's really good that you brought up Kate Raworth and her thing. And we could think about spaceship, we could just think about our own budgets, couldn't we, at home?
Yeah, absolutely.
And how do you manage that? And what I really like about the donut economics is there is a minimum spend that we have to do to keep people fed and watered and in a sense healthy. And then applies to healthcare is that we understand risk, but how well do we understand risk? And it's good that you brought up that, because there's always that temptation. Well, we'll just do another investigation just in case, and then another investigation just in case, because that first one might not have been right, or I might have misread it. And there's that temptation to do that. And what I like here, and what you brought up, is that at the individual clinician basis, we can be going, well, actually, what is the impact on this? Rather than, so I'm worried, is this helping me or is this helping the environment? It brings another sort of point to the equation that is less emotive.
Much less emotive,
And so what would this mean to my household expenses,
exactly.
or if I lived in there. So I think you bring up that. One of the big challenges, and I'm sure that Catherine will come onto this, but just really quickly, you mentioned the sort of the metrics there. We have to write business cases. It's hard enough getting a business case through to serve the population that we think that we need to. Is there a couple of things that you would just bang in there into the business case that doesn't require too much thinking about, but is something that we can start to balance? What would you put in?
Yeah, I think so to caveat that a little bit. So one, what we've done well in NHS England and is coming through NHS Wales and Scotland, and in fact Wales and Scotland are just moving forward with it. In fact, you're further ahead, but NHS England have put that regulation in around tenders and started weighting it. So from an industry perspective, we have that regulation coming. We haven't seen that in other healthcare systems yet. It's coming, but that will also help drive that metrics. The important piece with this, though, is who is the decision maker at the end of this? Because if it's cost, and this is again where it might drive a greater level of collaboration in that decision making process, because you've got different aspects to that. The societal benefit can't necessarily be measured yet. It's very qualitative, but you could still show that it's taking cost out of primary care or the patient turning up at A&E, etc. You can't, and there are aspects that you could start to put a monetary value on. The carbon footprint piece does need to be looked at a holistic perspective, because if you look at the whole of the patient journey and not the whole in the patient, then you get a better idea of what that carbon footprint is. So I think it's getting people to think a little bit broader than just their, oh my goodness, I've got a plastic glove, and the gloves is probably, although I've seen that being really contentious in some places, but it's more of a, I use this every day, and then there's this is uniquely important to that patient's life and the difference in their quality of life. And so I think it's that balance and working out, if you have to increase that carbon footprint, where are you reducing it from? Just in the same way, when you look at value-based healthcare and you're increasing the cost in some part of the pathway, where is it reducing it out of the system? I know Catherine will be talking about the actual metrics, so I don't want to talk too much and steal her thunder, because I've done their courses and it's brilliant.
No, it's brilliant. I think that just then brings us in.
Yeah, absolutely. So just 1 minute, just before we pass on to Catherine. So I think it's a really important point that you picked up, that through COVID, there was actually a forceful drive on innovation, because there had to be. And, the use of Consultant Connect between consultants, the use of appointments online, there are other savings there for patients. Whilst it might be a 10-15 minute appointment for the clinician each time, it could be a morning or a day off for a patient and carers, and a time and travel and free buses or whatever. So, I think the point you made is really important, that we don't lose what we've gained in that aspect, and actually really think about the value for the patient, not just the clinical outcome in that side, because actually that's really important as well. So
and in some ways, Dee, we might provide all the efficiency in the world to the system, but it really might be terrible for the patient.
Absolutely.
And so then it's balancing it and reverse engineering it back and going, right, well, there's going to be a segment of patients that this really doesn't suit. So how do we then forecast that budget, to your point, Nick, around supporting that segment of patients, and we start to forecast better, and then we get the budgets we actually want. A lot of this is around the good data to make good decisions, and that is key. Digital is a massive part of that, on the operational side, and also for connecting patients and reducing burden on the system, but data is key.
Lovely. Thank you very much, Amy.
No
and thank you for discussion there. I know we've got some questions, but I'm going to hand over to you, Catherine. Thank you as well for joining us today. So I've also done some of the Centre for Sustainable Health courses. They are amazing. We also delivered them to our board, who have all got objectives now that they've got to feed back on, I think, October. So definitely following this, we'll share the details of how you can find out more about the programmes, Catherine, because I'm sure there'll be a lot more interest. But hand over to you now to get us even further along the journey. Thank you very much.
Thank you all. Thank you for that. So I'm Kath Richards. I work for the Centre for Sustainable Healthcare in the SUSQI team specifically. It's a real privilege to work for the centre, because they really have been an organisation that's been leading the way in terms of sustainable healthcare for a number of years, way before kind of, you know, we all had green plans and targets and decarbonisation plans. So there's so much expertise there in the centre around how we think and how we do some of this stuff. So what I really want to focus on, I have got a couple of slides just that are just images that I wanted to share, but really focus on some of the frameworks and tools that have been developed by the Centre for Sustainable Healthcare and that we use when we're talking to clinicians and healthcare teams about delivering improvements in healthcare. And I think it really just builds on what you were talking about, Amy, and I think just so much of it is so much easily translatable to value-based healthcare. In fact, it just, like you said, I think you said, it kind of is that missing piece in value-based healthcare. So much of it you're doing already, and I think it is just recognizing it, perhaps being able to measure it and talk about it. But yeah, I think a lot of it is already being done, and I think it's just been a bit about telling the story of it. So I'm going to share some slides. Just bear with me a moment, because this is where it all goes wrong, isn't it? Can you see those okay? Yeah.
If you could just put them onto slideshow, there we are, perfect.
Oh yeah, you can see them. Okay, so CSH have really developed a three-pronged approach really to delivering and improving delivering sustainable healthcare. We have the principles of sustainable healthcare, which really guide all of the work we do at CSH. We have the triple bottom line, which is kind of what Amy was describing as the stool, the chairs of the stool, and then we have the SUSQI, Sustainability and Quality Improvement Framework, which I think just fits really naturally with value-based healthcare improvement work as well. So these are the principles of sustainable healthcare. You know, builds on what Amy was saying around prevention and patient empowerment and self-care being really key. And I see these as principles that can be used in everyday clinical practice as an individual clinician, but also when we're making service improvements and using them as concepts for changes that we can make improvements to drive sustainable healthcare. So they're really numbered in order of importance and power. So prevention being the first principle of sustainable healthcare. And again, just kind of repeating really what Amy said, this really focuses on health promotion, preventing disease and illness in the first case, and tackling inequalities in healthcare, really reducing the need for healthcare services is the most sustainable thing we can do. Absolutely. So it's where we should be thinking first. Patient empowerment and self-care is the second principle. So when individuals do become unwell and do need healthcare, empowering people to take a greater role in managing their healthcare conditions, reducing the need for healthcare activity. And there is evidence that empowering patients to take ownership of conditions leads to better long-term management and then better health outcomes. And you know, that's so integral to value-based healthcare, isn't it, around patient empowerment and patient outcomes. The third principle, again, for those services that we absolutely do have to deliver, how can we streamline them, make better use of the resources, and reduce and minimise wasteful activities. And then finally, low carbon alternatives, you know, where we have that absolute optimal service delivery and we're delivering only the services that we need to. What new innovations are there, new research evidence for lower carbon alternatives, and how can we kind of drive the value in those? And yeah, as I said, all of these principles I think absolutely align with the value-based healthcare framework, prioritising high value care activity and prioritising patient empowerment. So I wanted to talk a bit about sustainable value equation, which again is a framework developed by the Centre for Sustainable Healthcare, because it really helps us think about how we should be delivering care, what we should be considering when we're making any changes or improvements. So absolutely, when it comes to sustainable value, outcomes for patients and populations is always at the top line. So we're never trying to do anything that is going to have a negative impact on the care we give to patients or populations as a whole. And this is where we can really incorporate the broader view of whole populations and inequalities, thinking about access to services as well, not just the patients that are in front of us, but who is accessing our services. But in order to consider sustainable value as a whole, we need to consider that in terms of context of increasing demand for services and the finite resources that we have, which obviously Amy was talking about. So we can't really consider improvements to patient care without thinking about the impacts on the environment and financial impacts and the social impacts for patients in the wider community as well. And when thinking about this through an improvement lens, ultimately the aim of sustainable improvement is to improve patient care whilst minimising environmental and financial impact and increasing the social impact at every opportunity that we have. And the aim, I suppose, with value-based healthcare as well, it's not to solve the equation or come up with a single figure that kind of for any given initiative, but it's to make sure that we're considering each of these elements in any kind of improvement work that we do, and that we're considering them, we're trying to measure them, we're trying to understand what the impact is for each of these things. And I, coming from a sort of improvement background, I think about this in terms of, in improvement work we have outcome, process and balancing measures, and I think that's how I always see the sustainable value equation, that if we're trying to improve patient care, then we should have environmental and financial impact as balancing measures. We shouldn't be doing anything that improves patient care but has a negative impact on the environment, given where we are in the context of the world that we're living in. So that's really helpful, I think, to think about in terms of, and just build on what Amy was saying in terms of that 3-stool analogy, which I really like. And then just lastly, around the sustainability and quality improvement framework. So this really provides an approach to integrating sustainability into mainstream improvement methodologies. So with SysQI, it's not about a new improvement methodology altogether. It's just a framework for being able to embed sustainability into existing QI frameworks and improvement frameworks. And even, improvement can work at many different levels within a system, from bigger transformation to smaller projects within individual clinical teams. And you have to go through these steps in any kind of improvement or transformation. So when we're setting goals, we need to think about that overall aim that we've just talked about. Does it deliver better health outcomes whilst considering the environment? And then obviously you're going to have your kind of more precise aim within that. When we're studying the system, there's a really good opportunity to think about environmental sustainability. So before we launch into trying to change any service or make improvements, we need to understand the system that we're trying to change. And within that, we can look at what environmental resources used, what the social impact might be, where the financial resources. And what I suppose I want to get over most of this is the framework, but what this is, what the tools that we have available through CSH really help you to. There's a range of tools for how you might use process mapping and map the environmental impact onto that. And it's just how we use existing improvement tools really to help us study the system through that environmental lens. So I've put a QI card on there just because it links to our website, which has a range of open source tools and materials. So it's why I wanted to share that. They're all available freely for people to use. Another important phase where we can think about sustainability through the improvement process is when we design the improvement. So we've mentioned the 4 principles. If we think about these 4 principles when we're designing any service change or improvement, they can really help guide us to that ultimate aim of improving health but reducing environmental impact. And then lastly, measuring impact, which we've talked about. I've not really gone into loads of detail, but we can have a bit more of a conversation about how you do measure across the triple bottom line. I think in value-based healthcare, you've got a lot of the answers around how you measure patient experience, patient outcomes, potentially population outcomes, social impact, financial impact, but it is just that missing piece of how do we measure that sustainability impact. And again, this is one of the areas that CSH do have expertise, because we've been working with clinical teams and healthcare systems for a long time and looking how we measure the environmental impact. And carbon footprinting is one way to do that. There's not necessarily an agreed currency of agreed ways to do that, but carbon footprinting is one way, but there are other ways. and it does depend on the context of the improvement, or the scale of the project or the initiative, really, as to how you would approach measuring environmental impact. I haven't gone into detail here, but we can have a bit of a discussion around that. And then I just wanted to show you, in terms of the principles of sustainable healthcare and improvement work, if we are looking to do a piece of work around improving health or reducing climate impact, it can be really helpful to think about the principles as kind of drivers and as change concepts. And this is just an example from respiratory care. If we apply the principles of sustainable healthcare as change concepts and things that we might want to focus in, prevention we'd be thinking about, and this might not be in the scope of a project, it depends how, the context again of which you make an improvement, but we'd be thinking about things that prevent the illness, so better homes, insulation, reducing pollution, those kind of bigger public health. But there are things within the health service we can do, smoking cessation support. When we're thinking about patient empowerment, we could be thinking about working with people to improve their exercise habits, improving how they use inhalers, earlier recognition, and then lean pathways. It's looking at the pathways themselves. Is there anything that we can do to have clinics within GP surgeries, virtual clinics, so that patients have access outside of the normal pathway? And then lower carbon alternatives are those actual swaps. So it's quite well known in asthma care that inhalers are a massive carbon hotspot. So can we have alternatives that have a lower carbon footprint? And then operational resource use is really that kind of the thing that most people think about when we think about sustainability: buildings, energy, transport, all of those things that are kind of traditional sustainability within healthcare. So that was all I wanted to share with you in terms of slides, but I don't know if it's helpful to talk through a bit of an example of a project that we work with lots of clinical teams. Have I stopped sharing now? Yeah. We work with lots of clinical teams in a variety of ways at CSH. We have scholars and fellows, we run green teams competitions, and we have lots of educational packages around sustainability and quality improvement. But a good example, I think, and we actually had a showcase yesterday of some of our work, and we had a presentation from a consultant for in Northampton, who covers a regional HIV service. They were involved. Northampton signed up to one of our green team competitions, and the team were involved in the competition. They initially came to the competition with a project they had around recycling and waste, and part of the green teams competition is to get people to think about applying the principles of sustainable healthcare and the kind of that hierarchical principle of prevention. And so initially they came on to do something around recycling, which a lot of teams often do. When you think sustainability, you think recycling and waste, but through working through the initial workshop, thinking about the principles, actually they realized they already had a program for it they were already working on, or wanting to do some work around the patient pathway for really stable patients, and so they just kind of viewing this from a sustainable lens, which I think is what we're talking about. We're already doing some of this work and thinking about these things, but they hadn't viewed it through the sustainability lens. They did that through the cycle of the project. So they looked at the whole patient pathway, realised that a really high percentage, 80 to 90% of their patients had been on the caseload for a number of years and were actually deemed very stable in terms of their HIV care. They did a lot of kind of co-production with the patients and wrote out to them and said, look, we think they actually developed a new kind of cohort of patients, because it was the lead consultant for the region. She was the right person to drive this forward. Had lots of consultations with the patients around, look, we think you're in the stable cohort. Can we work with you to reduce your appointments throughout the year? So I think no matter how stable a patient was, they were still coming into the clinic twice a year. So people who were really early in the pathway, people who've been through the service for many years. So they worked with this cohort of patients to reduce their appointments to annual appointments. and just do a telephone call. And within that, or with the sustainability lens, they were able to kind of think about all of the equipment and the resources that are used for one singular appointment, which for this particular service was blood tests. Yeah, obviously the resource use of a patient coming into the actual clinic and the resource use that, you know, an outpatient's appointment takes. And actually there were just lots of benefits for, you know, prioritising the greater need for patients who were quite new onto the pathway and who had less medication adherence. The patients were more than happy to be seen less regularly because their symptoms were under control, their, you know, illness was under control. Actually, there's a fair amount of stigma still around HIV, and they didn't want to be taking time off work, and we're really happy with it. They did have safety nets and balancing measures around the clinical implications of that, and patients had choice. They didn't, you know, if they didn't want to just have the telephone appointment, they could have a face-to-face.
So, I mean, sorry, Catherine, it
That's
was
okay.
just, and how do you measure this? Because I really liked what you put for the asthma, and it's a game of marginal gains, isn't it? Because you've sort of all of those little things. But then it's the question is, well, how do you measure that? And, you know, we're not all Dave Brailsford with thousands of metrics that we can then tweak a cyclist the way that we want. Because business cases are pretty crude. And how do we assess how we're doing? How does an organisation assess how their individual components are doing? And do you get a sense of that? So with the HIV one, what were the sort of the key measures that people walked away and said, you know, this is brilliant? So
they used that value equation to measure. So they measured across all of those elements. So in terms of the outcomes, yeah, I think they had patient kind of clinical outcomes that they're continuing to measure for the patient side of it. But they were able to carbon footprint the reduction in the amount of patients coming to an outpatient appointment through all of the equipment that's used and the resource use of an outpatient's appointment. They're able to give a carbon footprint and project that over a year to say, and I think it was around a massive amount of patients that they're able to put onto this new pathway. 80 to 90% of patients, they're able to make an actual carbon footprint of the environmental savings. Social impact is always a bit more difficult. They use qualitative feedback from staff, but also were able to map the staff time that was saved. There wasn't a financial saving there, but they were able to demonstrate the value then that staff could spend with the patients that had a greater need. So they demonstrated the social impact that way. And the financial impact, again, there wasn't a saving from the staff side, but there was from the tests and the outpatient appointments that they managed to save. So it was just a case of, I don't know how that feeds into a bigger kind of beast, and that's, I think, a challenge of how, as an organisation, but I know being able to measure across all of the triple bottom line, they were able to demonstrate that value and consider it, I suppose. I think I like what Amy said before, is that some of this is qualitative and sort of finger in the air, how are we doing, but at least we're starting to collect it, and then we can start to say, well, these are the key things, you know, that we should be measuring. I think we'll get a better sense of it as we move along. But you mentioned that so a particular asthma pump is a carbon footprint hotspot, and so, you know, we can all look after our rubbish, you know, and recycle in a certain way, but actually that's minimal compared to one air flight. And so do we need to be thinking about it in that equation? Because then it stops us doing the little bits, doesn't it? I mean, how does that work out? I think we do need to be more aware of I think carbon literacy is really important. I think in personal life and in professional life, I think a greater awareness and understanding of carbon footprint is really important. And I think that whatever we do with the smaller bits and the larger bits, I think they're all important. But I think if we're talking about value and we're talking about prioritising and biggest impact, then we need to understand where footprints are, so that we can tackle those bigger problems. But I think the little things that we all do every day are also really important, and the fact that we understand the impact of them and making changes just creates more of a kind of culture and an understanding around it. So I think it's all important.
And
Amy,
To that point, though, I think perfection is the enemy of progress here. And that you've got to think about it on a macro and a micro level, your responsibility, and then the hospital's responsibility, and you know, a doctor's responsibility, and then the hospital's, you know, if we also think that perfection, then you stop doing the small things, well, then you're not contributing as well.
And Amy, I want to bring in perspective from industry as well, and this also links to one of the pre-questions that we were sent in. So the question was, and it's straight on with the asthma pumps. So you know, people were saying obviously the green asthma pumps are much better to be used, but they're much higher cost. Could that still be considered value-based healthcare? And obviously from a industry point of view, if there's minimal of that product being purchased, then the cost price is always going to be higher. So what's some of the things that we can be doing with industry to kind of level up and balance from a value-based healthcare point of view and sustainability? How can we be working together on some of these issues?
So I think this is where we've got to remember that innovation sometimes has cost more in the whatever you're purchasing, and if it's a technology, that becomes sort of microscopic in the conversation, but actually it's about drawing it out and looking at the holistic piece. Industry is obviously going through a huge revolution in itself, and a lot of the big players in this space are global. So, you know, there's also a partnership piece here. So obviously we've got to do our bit on our supply chain and work on our scope 1 and scope 2. And obviously our scope 3 is now being measured, and a lot of the medtech companies and pharma companies are now reporting through a framework to do that. And we've just had to report our carbon reduction plan. So if you're interested in what industry is doing, we've just had every company to remain compliant and sell products into NHS England has had to report their carbon reduction plan. So you can see the milestones there. From a partnership perspective, it's understanding that, you know, we're suddenly going to have to start, you know, purchasing from different places. We've got to then forecast how can we build that roadmap so that we can feed that up to, you know, our big chiefs in the US for us, and, you know, start saying this is the direction of travel, this is what's going to happen. In some instances there's a commercial risk, you know, and it will become that instant because there is going to be innovative companies that come out, so we have to stay ahead of the game but also do the right thing. That partnership piece is really key. You know, how can we do things differently? How can we even look outside of just recycling? If we're looking at circularity, some materials, well, yes, you could reuse them, but you could sell them into a different industry within, you know, local business, and that will create a higher circularity plus drive some economic, you know, aspects and social value in the area. It's just going to take a bit more work, but I think that collaboration piece of changing the conversation. How can industry put more into prevention rather than the aspect of, you know, just that intervention itself? And, you know, even if that's working in schools, how do we do more about the education piece? Sometimes it does cost more, but for us to drive costs down, we need volume, but we also need a roadmap. We're not expecting volume overnight. And that's so I think if we can put robust business cases back the other way, that helps.
Yeah, absolutely. And I think it's like any innovation, isn't it? Who had mobile phones back when they were first coming up, and then it becomes the way to do it, but someone's got to be the pioneer and to drive it forward. And I think patients are doing that. And it, you know, I think it goes back to what you were saying about collaboration. You know, we're talking about what the clinicians want to be able to give the patients, what the patients want to be able to use. But then it is about our finance, as Sally said, you know, our procurement processes and the business cases that we're writing, you know, being able to work together on all of this and then measure it and show the benefits. And to consider, I think, sustainability in the patient experience measures. You know, it's not something we automatically collect because it's more about how was the area. But I think there's a lot of it's a big issue, and I think there's a lot of opportunities through the work that we're doing collaboratively to look further.
And is it too far? Because you mentioned, Amy, about personal accountability, to does it become too strong a leverage to get the patient to think about this as well? When they're asking for the extra test. I don't know. Is this, language that we have to consider?
Well, but we have seen this in some instances, haven't we? We've seen refusal of surgery until you've reduced BMI, for example, in some instances, because we know that the outcomes aren't going to be the same. But if you put that in this is about consideration, and this drives back to the person, but also the population and the pathway. Are we doing the right thing for the right patient at the right time? And then with those outliers, potentially, how do you challenge that norm? But you've got to create the time and the space to have that conversation with that patient. And so by creating efficiency, hopefully you've got time to do that. So it's a bit of a circular conversation. But yeah, I think it will get to that point where you have to challenge people. But I think we're a long way off that yet. And also, not one person's pain is always a good example. One person's pain is different to another person's pain. So again, there's got to be some wiggle room in that. But if you are having to do something different for a patient, and how are we offsetting that? How have we forecast that in our carbon burden or our social value burden? Or is it providing that much more social impact to that patient by doing that for them? Because they'll go back to work and they're worried less. So actually they're going back to work and they're not off sick, and they're there are going to be these cases where we have to look at them microscopically.
And Catherine, when we think about patient choice, patient experience and health literacy, the sustainability issues and the environment issues, I see it coming more through from generations. And I think we're going to get to a position where they start demanding it from us, not, but that's part of health literacy. So what are my options through choice of care? Fantastic. I've got asthma and I have a pump. I want a green one. What's your view on what's the future going to start looking like with the generations as they're coming through?
I don't know. I guess it's hopefully patients do. I mean, we want to involve patients in decisions, don't we? And that's absolutely what we should be doing. So I think it's I guess as people become more aware in the public, then they are going to be demanding these, and already I think patients are well versed in their own care and do demand things off. But I think it's as clinicians being able to have those conversations about. So I think we need to upskill ourselves as clinicians to be able to meet the challenges and the level that we'll meet the public at. And I think people are, as I talk to more and more people are aware of the climate emergency, environmental elements, and as we give more information, I don't know. I think it's a challenge that we have to meet, a challenge that I think
Well, I'm looking forward
together.
to the time. I'm looking forward to the time when I am asked. So which one's good for me? Which one? No one ever asked me which one costs more, because the assumption if it costs more, then it's obviously better.
Yeah.
But it'll be great if someone then says which is the greener product, which has a lower carbon footprint, and the more people that do that, then procurement's going to change as a result of that, because we know that that's what patients are asking for, and hopefully we'll get to that. I wonder if on the apothecary podcast, whether they've addressed this. That'll be interesting.
Be interesting to pick that up. We've got some great comments in the chat as well about some case studies that people have taken place, and they are being collected in across Wales. We're also the value-based healthcare leads are going to be getting together with our green scholars and our green parties, which clinicians and everyone else can join in our own health board. So you can become a green champion if you're really interested in this area. But we're going to be organising an All Wales showcase so that we can find out about all of the projects that have been going on across Wales, but also so we don't, again, let's not waste time or anything else and duplicate. Let's learn from the projects that the scholars have been doing, which are amazing, and see what we can scale up. So we'll make sure that we share that information with everybody, because I think that's going to be really exciting to hear what has been done, what the capabilities are, and I think the opportunities for spread and scale across Wales are going to be fantastic. We've shared Catherine's link to the Centre for sustainability and health. There are some brilliant courses on there, right from introduction. They go right the way through. So there are some specifically for different conditions on how you can look to improve and think about sustainability in your area. And also, if you are particularly interested in SUSQI, so sustainability and quality improvement, that's how you really can learn how to do the calculations, how to look at the measures, all the different types of sustainability areas. So reducing your DNAs, you know, we've spoken about online versus face-to-face versus recycling versus circular economy. So there are some brilliant courses. We've been running some locally and with some of the leads as well. So I think it's a really good opportunity in Wales. We like to be driving some work forward, but there's still a lot to do, guys. We're really grateful for you joining us today. Just as a last thought, looking at the time, where do you think we can add the most bang for our buck, and what do you believe would be the best next step for people who have joined us? So if I start with you, Amy.
Okay. Oh, the pressure. For me, I think the next best step is to work out in your health board who is doing some good work already, and to learn from them, and also link into the Centre for Sustainable Healthcare, because those metrics are good. They'll get you thinking differently. We don't know what we don't know, and this is all about curiosity. So, you know, just start becoming a bit more carbon literate and work out what you can do, but how you can collaborate with people. I think Sally mentioned in the chat that this is sometimes outside of your control to how you change it, but go and speak to your finance partners, see what they're being measured on, you know, learn a bit more about your system so that you can understand how to write those business cases. I think for the biggest bang for your buck is start to look at where you can add efficiency to because no health board trust anywhere is perfect. So, you know, can you start doing more day case? Can you start doing more virtual appointments? How do you start measuring that? But put these metrics into your audit data so that you can start building it into your business as usual. And then when you pull all the data out to prove that it worked or it didn't work, you can learn something in those aspects as well.
Lovely. And Catherine?
Yes, I think awareness, we've talked about developing more awareness around, you know, the whole issue, and there's so much out there to understand, and just becoming a bit more carbon literate. Accountability is really important, isn't it? So what is your role? What's within your role and remit to be able to change? And there are so, you know, from small changes to, you know, if you are a senior leader, then absolutely what can you do to change the systems that you lead? And then I think you touched on it, but spreading and adopting best practice that are not reinventing the wheel. So there's lots of good work already happening across, you know, Wales, a huge amount of work across Wales, but also across the UK. And it's, you know, we already see it. I think there's lots of people doing similar things, and it happens all the time across the NHS, doesn't it? But there are lots of networks. I think Stacey's posted in the chat around the Green Health Wales network, which is a great place for people to connect to see what's happening. Similarly, we have a range of networks at CSH. So do look, if you've got an idea of whether it's looking at a particular patient pathway or within a special, see what else is going on, and yeah, speak to people that are already doing this work. Collaboration and yeah, working together, I think is absolutely key.
And Nick, I know you were really interested in this topic.
Yes.
So I'm really interested to hear what's going on in your brain, and then if you've got any final questions, because there's some great case studies that are going on in the chat, which I'll be taking some notes of. But I'm really interested to hear what your thoughts are, and maybe to share with our.
Well, I think it's for me, it's just reimagining the conversations that we're already having. You know, we've been trying to drive efficiency for how long? We've been trying to drive local care, you know, all with, you know, carbon footprint in the back of our mind, but now it's front and foremost. But it's still after the same agenda, you know, and it's just about looking after ourselves in a more systematic way. And so I've really valued this conversation, because I didn't know where it was going to go. I haven't been benefited, and I probably will sign on to a SUSQI course. You know, this is the best advert coming out of this. And I will be, asking my colleagues about, well, what are they doing and in this? So it will become part of the conversation. And I do think we need champions in this. And so we'll be looking to our organisations, within paediatrics, who are our champions. We had a talk on this at our St David's Day conference, not last year, the year before, really front and foremost in it. So it's happening. But it is that new lens, and what I really like is that you've given it now an equation and you've given it a framework, and that first slide that you popped up that in the quadrants, that's it. Yeah, lean service, the whole bit. So I've this has been a winner for me.
Fantastic. So from my point of view as head of value-based healthcare, I'm really keen that we adopt the 4 principles of sustainability. It sits in a different part in my organisation. It sits in strategy and transformation. So I think it really drives us more working together. I'm looking at the measures that we're going to be supporting people to collect and think about. My takeaway is I want to go and look at those patient experiences and see how we can include information around sustainability and start gathering some of their thoughts on it, because it's not something we automatically do, and if we're not collecting it, we can't measure it. So I think we can start asking. And I know that my fellow value-based healthcare leads and the National Value in Health team really see this as a key area to work on. I think we've covered all the questions. Nick, I'm going to hand back to you because I know that we've got more value-based healthcare podcasts coming up. So, and there's lots of people couldn't join today. It's gorgeous weather out there. It's a bank holiday weekend, but as always, it's being recorded. So thank you if you join us and watch this back on a recording. But over to you, really, to close us down then.
Yeah, so thanks very much to you both. This whole thing's been brought to you by the Welsh Value and Health Centre, and we're really grateful to the team and to Sally Lewis for that. We do have a website, and we draw your attention to the website where you can then have a link through to the YouTube recordings for this, and that's you're more than welcome to continue to comment and add to the chat. After that, there's also Twitter feeds that come out from this. So I've learned what triple bottom line is now, and that's going to be part of my new value content, and it's not going to be comments on any of my patients.
So have a wonderful bank holiday. Thanks again to the speakers. Thank you, Nick, for having me again.
Thanks, Dee.
And we look forward to seeing you again soon. Take care. Bye-bye.
Thanks for having me.
Us.